did my project on whooping cough, also known as pertussis. So microbe structure and characteristics is caused by Bordetella pertussis bacteria. It is gram-negative. It is rod-shaped. It's a Cocciobacilli. It can be paired or singular. They're encapsulated. It performs respiratory metabolism. It's a strict aerobe, which makes sense because it's found in the upper respiratory tract, and the upper respiratory tract obviously is going to have oxygen going into it. Bordetella pertussis attaches to the cilia in the upper respiratory tract, and this is its mode of infection. So here's the cilia, and then there's the pertussis, and it attaches to there. So microbe characteristics continue. It's an RNA genome. It's a Pertussis bacteria. It's slow growing, 3 to 6 days, which sounds pretty fast, but in the bacteria world, that's pretty slow. Bordetella pertussis grows on rich media, synthetic media, and its selective growth media is a charcoal agar. And here it's the colonies, and you can see some are grouped together, some are separated. So, virulence factors. It's a filamentous hemagglutinin, adhesions. It has fiambrate, protactin, which is an outer membrane protein. The fiambrate and the protactin help B pertussis to attach to the ciliated epithelial cells in the respiratory tract. So this is how it infects the body. Okay, so some background history. So outbreaks happened as early as the 16th century and were described by Guillaume de Belleau, one of the most common causes of childhood death in the U.S. during the 20th century. It was isolated by Jules Bordet and Octave Genove in 1906. The first vaccine was invented in 1914. Before the vaccine, around 200,000 cases occurred in the U.S. each year, and as of 2020, there's about 5,000 cases in the U.S., which sounds like an amazing decrease, but when you look back at the charts and stuff, it's actually starting to be a slow rise again, so it's a little scary. Here's Jules Bordet and Octave Genove. Okay, so symptoms and complications. The incubation period is 10 days. Illness gets worse after the 2-week mark. It has 3 stages. So the first stage lasts 1 to 2 weeks. It's onset with gradual progression, no or just a low-grade fever, rhinorrhea, lacrimation, dry cough, and malaise. And at this point, it's highly contagious. So just kind of like a common cold to begin with. So the 1 to 6 weeks is the middle phase, but it could last up to 10 weeks. So here's where you see all the problems. So periods of coughing occurring after rapid succession during one exhalation. Inspiratory whoop may follow. Coughing spells, post-tussive emesis, cyanosis, and exhaustion. Leukocytosis, lymphocytosis, and weight loss happens, and this is when these secondary infections start brewing, such as pneumonia. So the 2 to 3 weeks, the third phase lasts 2 to 3 weeks. The coughing lessens, and susceptibility to the respiratory tract infections happen. So when you look at the illness as a whole, it lasts a pretty long time, which kind of helps it set it apart from just a regular old sinus infection or a cough. And this whoop also sets it apart in the extreme issues that it causes. So, transmission and diagnosis. So it's transmitted through droplets, coughing and sneezing, close contact to an infected person. People who are vaccinated and healthy can still be a host for pertussis and give it to someone else, which is very interesting. So you cannot have any symptoms but still be a carrier of it and give it to somebody else. Vaccinated people can still get pertussis, although it's uncommon. The vaccine is pretty effective. A swab sample of the nasopharynx is tested for Bordetella pertussis. So as you can see here, they insert the swab through the nose back to the nasopharynx, which is pretty far, farther than like a flu test. And then Other tests that may be performed are a chest x-ray to rule out conditions such as pneumonia, a CBC to check for an elevated white blood count, which with any infection you're going to have an elevated white blood count, but it just kind of proves that there is an infection. Epidemiology, risk factors, and prevention. Okay, so it can occur at any age, but unvaccinated young children are at higher risk. Children tend to get more ill than adults with pertussis. Infants are at highest risk of complication. The best prevention is the vaccination. Good hygiene, preventative antibiotics if you have been exposed to someone else who has it. So if someone else in your family has had it, your doctor may prescribe you preventative antibiotics to keep you from getting it. Okay, so vaccinations based on age. So young children up to 6 years old get the DTaP vaccine, and then the rest of the age ranges get the Tdap vaccine. So the DTaP, it actually stands for diphtheria, tetanus, and pertussis. And so does Tdap, it's just tetanus, diphtheria, and pertussis. So it's a 3-in-1 vaccine. And so for young children, you get the DTaP vaccine, and then for preteens and up all the way through adulthood, you get the Tdap vaccine. And lots of women who are pregnant are skeptical of getting vaccines, but it is safe through the 27th through 36 weeks of pregnancy. Okay, so treatments: azithromycin, clarithromycin, erythromycin. These are antibiotics. Hospitalization in severe cases. Supportive treatments such as oxygen, breathing treatments, and treating the secondary infections. So here's my sources. Okay, so some exam questions. Although pertussis can infect anyone at any age, what age group is at the higher risk for complications? Infants, geriatric adults, 6 to 10-year-olds, or 20 to 30-year-olds? The answer is infants, and that would be 0 to 1 years of age. True or false? Someone who is vaccinated and shows no signs and symptoms of pertussis can still be a carrier of the illness. That is true. So that's what makes it tricky. You can still be a carrier of it and not know that you even have it, and then go give it to a little baby. So, thanks for listening.